stakeholders that are on the call today for everything you do to provide and maintain access to care in rural communities across the nation. Particularly during times such as these, we greatly appreciate and value the work that you do every day, and really hope that you find that the resources and the time that you spend with us today is helpful in helping to in moving things forward. So just wanted to start with those thank yous. To give some perspective of what we're going to talk about during our time together today, this is a whole HRSA grants overview. And so we'll be starting with some basic information regarding how to apply for an HRSA grant, how to write a strong application, some common mistakes and tips that we've learned along the way and are happy to share, as well as some technical assistance resources that can be useful as you're considering and thinking about applying for HRSA grants. Sorry, I'm having a little problem here. And so as I'm getting that straight, to give you an overview of HRSA, HRSA supports more than 90 programs that provide healthcare across the country. And so surely a list of 90, I wouldn't be able to name them all today, but even within those 90 programs, there are various initiatives and programs that work that are operated at the local level that really span the genres of public health. We do this through cooperative grants and agreements to more than 3,000 awardees. And I'd just like to highlight there's not one particular type of awardee that we look for or target for grants. These awards are distributed amongst all ranges of partners, whether it's academic partners, hospitals, community-based entities, faith-based entities, tribal governments. They really span the breadth of those that are able to do the programs and really support the public health efforts. And then each year, also just want to say that we serve tens of millions of people through these programs and services that are provided via a wide range of partners. To give some scope of the reach of HRSA, in FY 2020, the appropriation for HRSA was just shy of $12 billion. It was about $11.9 billion. And I will say that that does not include the most recent funds that have been allocated in response to the various COVID response efforts. But the annual appropriation was approximately $11 billion. And you'll see, looking at this, just to get a scope of where do those funds go in a year, a large portion of that being to support primary health care through the health center program, as well as through health workforce development, efforts related to HIV and AIDS, as well as rural health. Within that broad scope, and I'll talk a little bit about some of the divisions that are within that broad scope of programs. So I wanted to just highlight some examples of, what types of grants hospitals could think about and apply for. So this is just a snapshot. It is not an exhaustive list, but just to highlight that there are grants. HRSA currently awards grants to hospitals for programs such as workforce development. So you'll see initiatives here related to nursing workforce diversity, preventive medicine residencies and residency training included on this list. You'll also see programs such as the health center program, which we talked about, the federally qualified health centers, as well as services and grants to provide Ryan White HIV and AIDS services. And then also included on this list as an example are programs that really help to build consortiums and bring together a cohort of partners. And you'll see that example included in the Rural Health Network Development Program and other outreach programs that are there. So there's a wide range of programs, not just specific to any one bureau, but the various health initiatives that are supported across the HRSA. Within HRSA, we have multiple divisions, of which I'm going to talk a little bit about in the next slide, but also wanted to highlight that we do have 10 offices across the nation. The Office of Regional Operations is one of the divisions that operates in each of the 10 HHS regional office locations. And so while I may be on the phone today representing Region 3, please know that through all of the regions, as you see them represented on the map, spanning across the country, where there is a regional office, there is someone like me also in that office doing this work, and not just targeting the state in which they may be located, but also all of the states in that region, really to support getting information out about HRSA resources, as well as looking for opportunities to partner and build partnerships across the region with those that have HRSA grants, as well as those that don't. There's a wide range of materials and tools and information that we share, and we really try to do that partnership building. So as you go through this session today, surely if you hear some information and want to know a little bit more about contacting your regional area, please do feel free to reach out to me, and I'll be very happy to connect you to your regional partners. To go a little bit more and just to provide a little bit extra context about some of the programs within HRSA, one you may be very familiar with is the Health Center program, which serves more than 28 million people. And just want to highlight that in the health centers, approximately 1 in 5 are rural residents that we're serving. So definitely, and also providing care, not only primary care, but behavioral health care, dental services, really providing a comprehensive swath of care in the health center program. In addition to that, HRSA provides services to support HIV and AIDS treatment and care. And in 2017, we will see that there were multiple patients and clients who visited rural providers. And when looking at the outcomes of these programs, we're very happy to say that we're having in rural communities showing that efforts to make sure that people are maintaining, staying healthy and maintaining viral suppression is really trending with that we see happening across the nation. Another bureau and division within HRSA is the Maternal and Child Health Bureau. Under this bureau, there are many programs that fall within this bureau, one of which you may be familiar with is the Title V program, which goes awards at the state level to really support maternal and child health programs and infrastructure throughout the state. But in addition to that, also, there is the Maternal, Infant, and Early Childhood Home Visiting Program that falls under this banner as well. And so you can see just from this slide that we're having a broad scope of really being able to support residents in communities across the country and have seen great participation from rural communities and participants in the Maternal, Infant, and Early Childhood Home Visiting Program. Certainly, and last on this list is the Federal Office of Rural Health Policy, and so whom you may be very familiar with just via support for this particular program, but really provide a broad range also of programs to support networks, telehealth, access to care across the country with over 200 grantees, and with 80% of those programs continuing even beyond the time that they have the program and building that sustainability in rural communities. And so all of these programs, of course, are included on the HRSA website, and we'll have a link to that at the end of the slides if you haven't had a chance to take a deeper dive into the HRSA program. Not included on this slide, but we also wanted to mention is that we also have the Health Systems Bureau, which also supports organ transplantation programs, and as a result of that program in 2019, supported over close to 40,000 transplant services as well. So now we'll get started and get into the meat to give you some scope of the types of programs to think about when looking for HRSA grants. And so now we want to talk a little bit about the application process. Where does it start? What do you look at first? And so we'll start to go into a little bit of that now. The first pieces of which are to get registered. There are some systems that entities must be registered in when they begin to think about HRSA grants and federal grants for that matter. One being the Data Universal Number System. We often call it DUNS, so if you hear that name, the DUNS system, many of you may already have that. And so this is where you register to be able to, with the federal government. And then following registration in the DUNS system, you'll follow the arrows there. The next piece is the System for Award Management. But these two systems will be the systems that help you to get registered with the federal government and then have an authorized organization representative that's been able to submit grant applications and represent your agency in these electronic systems and do business. And so the two steps, the DUNS number and the System for Award Management number, are very important because then they also tie into the grants.gov system where you would eventually submit the application. The reason we do focus on this is because, as you can see, there's a little arrow there. Those systems can take up to 4 weeks. So these are things that you don't have to wait until you're ready to do a grant application for. As I said, many of you may have them now. You may not. You may want to know who the person is that's authorized to submit on your behalf if you are thinking about an application. But you can do these things now, even in preparation. What you don't want to happen, though, is to wait you know, a couple days before a grant application is ready to be submitted to then find out you have these things in place. So as you're thinking about engaging in this process, I would just encourage you from the business system side to make sure that you've registered in these systems and are ready to go and have received all your notifications. Some of them include recertification or renewal processes. And so you just want to make sure that you're maintaining your registration with these 3 important systems to be able to complete the grant application process. So next I'll go to the federal grant application process. So I'm going to start this one off with a question. I'm going to see if we can do poll number 1 and ask you a question before we get started. Let's see. All right. So to start this, we're going to talk a little bit about grants.gov, but before we got started, we wanted to ask you, when it comes to grants.gov, have you been on it all the time? You regularly search and submitted a grant? Have you visited but never submitted, just kind of perused to see what was there? Also, are you just aware that it exists, which is also great? And then lastly, never heard of it. So I see a lot of fluctuation coming in here. It looks like the bulk of the group is hovering between, let's see, I'm on grants.gov all the time, and some have visited but not submitted. But then also seeing that a good portion of you are aware of it and have never heard of it. So we're really across the spectrum here with this. So hopefully you'll be able to hear some information about grants.gov today and its usefulness to helping you apply for grant applications that'll be helpful going forward. And you'll be able to, the high winner in this poll was having visited but never submitted anything. But many of you have also seen it in some format. So thank you. So what you see on your screen now is just one screenshot of grants.gov. It's a landing page, but really is a great starting point when even thinking about federal grants. There are a number of tutorials and tools on grants.gov that show you how to use the grants.gov website. There are resources if you're interested in additional tutorials about it. The grants are submitted electronically through this system, and you'll see even on this header, it says apply using Workspace. There's a place for you to develop your application on grants.gov. So it's really a great starting point to seeing everything that is available. The other thing I'll say is I have highlighted here, for example, is to search grants, and you'll see that highlighted in the circle. And there's multiple ways to search for grants, and so we'll just go through and look at some of the other pieces here. Oh my. Sorry about that technical difficulty. Okay. And so you'll see here, when you search for grants, I have highlighted, as for example, a keyword. You can search by HRSA, but perhaps you have interest in other HHS agencies. Maybe you're interested in looking at something for the CDC. Maybe you're interested in looking in something for the Administration for Children and Families. You can type in whatever keyword you search you like, but there's also opportunity and on the left side of the screen as you scroll down to filter, and maybe you want to pick a particular agency or a particular grant. So you do have those options. The other thing I'd like to highlight on this particular page is that I have circled in the blue is forecasted and posted. Posted grants are grants that are currently open and available for competition and application. And so you'll see on the list that there are grants that are listed as posted with a posted date and the date that the grant closes. The other piece is forecasted grants. Forecasted grants are grants that are anticipated to open during the particular time period that's listed or fiscal year that's listed. They are not yet open for competition, but I always encourage people to pay attention to forecasted grants. It's almost like having the bonus of a little bit more time. You're able to see what types of grants will be put out for competition or proposal during the year, and so at some point during the year, and so it gives you a little extra time to think about, is this a topic or area that I'd be interested in, and knowing what's coming down the lane in terms of funding opportunities. So I would encourage you to look at both forecasted and posted grant opportunities when you're thinking about using grants.gov and looking at HRSA grants. Once you've selected a grant on grants.gov, it provides you with a snapshot of information and then information to the grants package. You don't have to apply in that particular moment. You'll certainly see some general information as displayed very microscopically on our screen today, but you'll be able to see some information about it, the number of awards that are expected to be made for each of the grants that are listed, and some general eligibility information. But what I also encourage people to do at that time is also to look and get a preview of the grant application package. And so you can do that usually very easily by selecting package. Some grants may have links to other resources, but you'd be able to follow that through this system with the prompts and look at either preview or apply, and then download the information to find out more about that particular notice of funding opportunity. So grants.gov, as I mentioned, provides a lot of support. If you have questions when using grants.gov, they have a contact center. There's a way to set up for subscriptions, and so that you're getting the information sent to you and you don't have to always go on grants.gov. I would encourage, I look at it frequently myself, just because I know that the information changes so quickly on grants.gov, and grants can pop up all the time. So I look at it often, but I encourage you, if you haven't gotten a subscription, to sign up for a subscription if you're interested in a particular topic or keyword, to really take advantage of being able to sign up for a subscription in grants.gov to really keep up and stay aware of the new announcements that are coming out. And you can also control how you receive that information. In addition to grants.gov, you can also find grants on the HRSA website. At HRSA.gov, there's a tab for grants, and then grants will also be posted on the HRSA website as well. So just wanted to provide two ways to find HRSA grants. So the next piece, once you found a grant on grants.gov, we just looked at how to go through those screenshots, is the notice of funding opportunity. The notice of funding opportunity contains all of the information you will need to apply for a HRSA grant. It explains what funding is available, as well as what applicants need to do to apply. So we'll go a little bit into what's in the actual notice of funding opportunity. There's often several segments to a notice of funding opportunity, general information such as the description and award and eligibility, and then really the meat of the application itself, which is the application and submission information, where you'll write about your program and the various requirements that they're asking for in that portion of the grant application. In addition to that, there's some also key information in there, such as contacts, should you need that, as well as the budget and fiscal piece, which we'll be talking a little bit about later. I wanted to highlight in some particular pieces of a notice of funding opportunity. They are all very important. This will be your guide to putting everything together. They provide great detail about whatever program it is that you're applying to, and really succinctly highlights the pieces that need to be mentioned. And so I'll start with the executive summary. When you first look at a notice of funding opportunity, as you can see, these are just samples of previous funding opportunities. And so, for example, it'll provide the name of the program, it'll provide the award amount, and the number of awards that are going out, as well as eligibility. Eligibility for grants varies among the grants. And so you always want to make sure that you're looking at the eligibility and meeting the eligibility requirement before you start writing and investing that effort. And so it's always very clearly included in the beginning of the grant, as well as the project period. One other piece that's often highlighted in this section of the grant as well is technical assistance opportunities for grants that are published and open for application. There may be technical assistance sessions. I always encourage, if you're able to go to the session and or the replay of the session if you're not able to attend. Often these sessions, they're able to provide more information about the funding opportunity, as well as answer questions and generate frequently asked questions as a result of these sessions. So I find them very informative if you're considering a HRSA grant, to participate in those or listen to the replay. Next is application and submission information. This information, as I mentioned earlier, is really the meat and potatoes of the application, and you'll see it here in 3 snippets. But as you can imagine, in an actual notice of funding opportunity, it's multiple pages. But one of the things that I wanted to highlight on this is that it provides a clear outline for the project narrative. Often people wonder, well, what should I write about? What should I present? The project narrative section of a notice of funding opportunity very clearly outlines the type of information that should be included in an application. And it also correlates, and it will show you in the notice of funding opportunity of where that correlates to scoring criterion, which I'll talk about in a moment. And so the other thing I'd like to highlight is that in this section, you'll also find out what types of things are required, whether it's the work plan or a logic model or some other evidence-based information, what have you. That will all be contained in the application and submission information section of the notice of funding opportunity. And so you'll want to pay close attention to that and the materials and the information that is asked for. And I also say when doing the applications and the materials and things that are asked for, as you're writing those narratives and things, you want to be mindful if you're referencing something, an attachment or a chart or something that is included. I know that that can be very common, that you reference something and then somewhere in the shuffle you forget to add that last attachment. And so you want to pay attention to those things as they're called for in the application and submission portion of the application. Another key piece of this is the application review. So you're writing an application, you're very thorough, you've pulled together all your pieces and done a great job of presenting your program. One other piece I want to highlight is that the notice of funding opportunity will very clearly tell you the criteria for which your application will be reviewed. It will let you know the corresponding scores and points that are available for each of the sections so that you'll be able to see that in advance, as well as some tips to consider. And the other thing is that in the application review section as well will include information about funding priorities and preferences. Often there's questions, is there a preference for this? Do we get extra points for that? So you'll also find that in the application review section of the notice of funding opportunity as well. And I always like to highlight that just because so that it really helps to show the scale for which every reviewer will be reviewing the applications, and I find that to be very helpful when developing an application. The last piece I want to highlight is the award administration and agency contacts. This segment of the application can be very helpful. If you have questions, there are resources to certainly reach out and ask questions, and we encourage that. In addition, there's also a link to the SF424 guide, which we'll talk about in the moment, as well as it will help to give you a preview of the reporting that will be required as a part of this program. So this is also key information to consider when thinking about developing a grant application. I mentioned the HRSA FS424 guide. This is a companion guide to HRSA grants. And so this is also a resource you don't have to wait till you have a HRSA grant to see. If you're interested in it, it helps to provide information about resources, processes, and the grant submission process that may be helpful now, even as you're thinking about considering or looking to a HRSA grant. And so this is something that very easily you can get. The web link is included here to learn more about the application process. And I know Stephanie will be talking a little bit more about that as well. So we just want to give you a few tips as we're going into this next phase, the 5 R's of writing a strong application. And so we really encourage you to do the research when thinking about a grant application. There is an opportunity. HRSA has a data resource, HRSA Data Warehouse, where you can now look at projects that have received awards in the past. You can learn about the grant programs on the HRSA website. There are often many tools and reports generated about programs to really help you understand the history of that program that may be helpful. And often, sometimes in the notice of funding opportunity, additional background is provided there. And then it also addresses helps to provide information about the application requirements. And so this is an opportunity as you're looking at the research of the program to decide if you'd like to move forward with applying for a HRSA grant. It may often be the case that you decide maybe you won't be the lead applicant, but that this is a grant that you do want to partner with someone with. That's also presents as an opportunity. And so doing the research on the grant will help to bring those things to light. Next, recruit a team, an internal team. This could be a small team, it can be a big team. There's no right or wrong way to write a grant application. It may be that you have a grant writer do it, but you really want to make sure that you get feedback. With a NOFO, I say you want to read it once. You want to read it twice. You probably want to put it down and read it a third time and then give it to someone else to read, just to make sure that everyone on the team is reading the same information, providing helpful feedback. It really helps to move the process forward. And the same for even consortium and network members as you're pulling them in, to think about maybe sharing the notice of funding opportunity with them as well, which that helps to sometimes solidify the roles and participation levels of those in consortiums and networks that many grants may call for. You want to respond to the guidance would be the next tip that we have here. And so in responding to the guidance, as I mentioned, still a little stuck here. My apologies. Cassidy, are you able to?
Rhonda, let's see. I think I'm controlling the screen now. If you tell me what slide number you want, I can get you back there.
Sure, 34.
Okay, let's see.
I'm not sure what happened here.
34?
So I'm responding. Is it moving forward on your end?
Yes, so on my screen, I see slide 34. You might have just a little bit of a delay.
Okay, thank you. Okay, so on slide 34, responding to the guidance, you just want to make sure, as I've mentioned, the application very clearly outlines the pieces that are required, and we just try to stay away from, you don't want to assume reviewers' knowledge of your program or your area. So as we mentioned, grants are reviewed by a committee, and they may not be partners from your local region, they may be from somewhere else, and so you don't want to assume that they have a certain background knowledge of your town or your hospital or your partners, and so you just want to make sure that you're always responding and providing the information that they ask for in a clear and concise way. The next slide. Review your application. You always want to have multiple eyes on it to the extent that you can, to just help to continue to give you feedback. And then in terms of writing a strong application on slide 36, just want to say that writing a grant application can take 40 hours or more. It's a task, and so it's a very rewarding task. And so you just want to continue to make sure that you've reviewed things in advance, like eligibility, and if you have the stakeholders and systems in place to support that grant.
Rhonda, I'm so sorry to interrupt, but I'm getting messages from attendees saying their slides are not advancing. So our IT team has taken over the screen, and he's working to figure out why the slides aren't advancing.
Okay.
Just 1 second, and I'll just wait for an update from him.
Okay. And I can continue in the meantime, and these will all be available after the session, of course, but just some common mistakes. I just wanted to give a heads up. A lot of the common mistakes that we see are that partners may find out the grant is due at 11:59, and they go to submit the grant at 11:57, and something happens and they're not registered with grants.gov, or maybe not registered with the award management system, as we mentioned. So those are the types of things that you want to be mindful of in terms of common mistakes that we see with grants. A top 10 tip, of course, is to apply for the application early and make sure that you're giving yourself enough time to do it, to follow the NOFO, keep your audience in mind, be brief, concise, clear, and organized to the extent that you can. And then also to show fiscal, when you're completing the pieces, to show fiscal stability. Fiscal aspects are not something that should be thought of at the end of the grant application process, but really can be included in the various aspects of the grant writing process, as those will really reflect the work that you're doing in the program side. So just want to encourage that, as well as paying attention to technical details and the use of attachments. So having said that, I will say the HRSA review process happens in the Division of Independent Review, and an objective review committee is often selected to review the applications, and they're responsible for evaluating and rating the applications in response to the notice of funding opportunity. And so this happens across the grant. HRSA does have grant technical assistance resources on its webpage, and so, okay, we're up to slide 47. So HRSA does have grant technical assistance resources available on our webpage, one of which is RHI Hub, which I just would like to share is a very important resource, and you may be very familiar with. Often grants call for background information or references to pieces, or maybe there's some research that's available, and Rural Health Information Hub can be a great partner and tool in providing customized assistance to questions that you may have. And so, or if you're looking for data or information across programs, I'd encourage you to do that. On to slide 49, also the Rural Health Research Gateway is another opportunity to find information about research that's available to support your program, and that's also funded by the Federal Office of Rural Health Policy. We talked about on slide 50 the HRSA Technical Assistance Resource page, and then last but not least, also the HRSA data, HRSA.gov. I mentioned that there's an opportunity to find programs and see background information on programs that have previously existed. So you're able to find that on data.HRSA.gov. And so having said that, I'll also leave it on one slide back, which is HRSA Needs You. We often always are looking for reviewers for programs. So if you feel if you have expertise, please do by visiting the HRSA website to apply to be a reviewer of grant programs as well, in addition to being a writer. So it's a great way to learn about the review process in HRSA as well. So having said that, I am now going to turn it over to my colleague, Stephanie Sawalski, who will now talk to us a little bit about the fiscal aspects. I've talked about some of the program side, but the fiscal side is just as important. So I'll turn it over to Stephanie to talk to us more about that.
Great, thank you, Rhonda. Hopefully everyone could hear me loud and clear. So before I jump in, I just want to say thank you for taking the time out of your day to join us. I know we're covering a lot of information in a short time today, but as Rhonda and Cassidy mentioned, you will have access to our slides after the presentation. And I want to thank the Center for Optimizing Rural Health for hosting us today with this HRSA grants overview. And as Cassidy mentioned at the beginning, my name is Stephanie Sawalski. I'm a certified public accountant. I work in HRSA's Division of Financial Integrity, and I'm going to provide you with some information on the fiscal aspect of applying for a HRSA grant. So this will supplement the information that Rhonda just covered. But the one thing I do want to say is I realize that many of you on the phone may not be the financial representatives of your organization. So as I go through the information today, if there are any questions you have or you need clarifying aspects, please let us know. Let us know in the chat box, and I'll be happy to provide you with clarification on what I mean so that this information is really useful to you and helps you if you are applying for a HRSA grant. Okay, so let me just make sure I have the slide deck going. Okay, so hopefully you guys can all see slide 54 right now. And so in similar fashion to how Rhonda provided you with the top 10 tips for applicants, I'm going to share with you the top 10 fiscal tips for applicants. And before you actually apply for federal grants or our HRSA grants, it's important that you familiarize yourself with the regulations. So the regulations for HHS awards is 45 CFR, Code of Federal Regulations, Part 75. So remember, in step 2 of what Rhonda had talked about, it's you must demonstrate evidence of fiscal stability and sound financial management. Well, one of the ways that you can do this is you can incorporate ways in which your organization is compliant with 45 CFR Part 75 when you are applying or included in your application. And so I'll get into a bit of what some of these requirements are and what you need and some of the other top tips. But for right now, what I wanted to cover is with regards to 45 CFR Part 75, if any of you do have other federal awards and you are familiar with 2 Code of Federal Regulations, Part 200 or 2 CFR Part 200, it is very similar to 45 CFR Part 75. The difference is that 2 CFR 200 is the uniform administrative requirements, cost principles, and audit requirements for all federal awards, whereas 45 CFR Part 75 is really only applicable to HHS awards. And so there's a few instances in which there's additional clarification for healthcare related aspects of grants and federal awards. So if your organization is in compliance already with 2 CFR 200, this is a great start, but I still urge you to familiarize yourself with 45 CFR Part 75. And so one of the things that you'll notice throughout as I go to some of the slides, I will give references to 45 CFR Part 75 and where some of the additional requirements are within the Code of Federal Regulations. So the next part that you should know when applying for an award is what the legislative mandates are. And legislative mandates are statutory provisions that limit the use on funds on HRSA grants and cooperative agreements. And it is applicable to all federal awards as well. So if you do have other federal awards, these same salary limitations, restriction on abortions, restriction on pornography on computer networks, they're all applicable. And so just knowing and understanding these legislative mandates and things that your funds cannot be used for is important. Another one that I just want to highlight on here is number 4, acknowledgement of federal funds. This one is actually a little different in that this legislative mandate says that if you utilize our grant funds and you utilize them for issuing things like requests for proposal, or you use them for producing materials, that you must acknowledge your use of federal funds when doing so. So that's just another important aspect and something you'll have to keep in mind when applying for awards and just understanding if you are a successful applicant. Okay, so going on to the next slide. As a recipient, it will be your responsibility. I apologize, we're on the wrong slide here. Let me just go back one for you. Okay. I'm having a little delay on my end, Cassie. I'm not sure if everyone can see the slide, but ultimately, the third tip is that it's important for you and your organization to make sure that you're set up to comply with Subpart D of the Code of Federal Regulations. And so Subpart D is the financial management systems and internal controls. And as a recipient, it's important that you monitor your compliance with this section. So some of the areas I want to highlight in terms of the standards for financial management is making sure that you have the capacity to implement financial systems in your organization and that you're able to establish internal controls. And if a grant recipient does not have an adequate financial management system, which does incorporate these internal controls as well, it can prevent successful accomplishment of grant objectives. So it's really important that even before you consider applying for a grant, that you evaluate whether your organization can be in compliance with these sections. So just a couple key things to remember is that your financial management system should have the capabilities to provide timely, accurate, current, and complete disclosure of all financial information. And you have to be able to separately track all federal funding, because federal funding cannot be commingled with other funding sources. So in terms of your financial management system, you will have to have the capability to have various accounts and sub-accounts to always be able to tell what your funds were used for. And in terms of internal controls, you have to have a system in place to ensure that all costs charged to federal grants are allowable, allocable, reasonable, and documented. And you must have controls to just manage all the aspects of your federal award. And so again, I'm going to keep it very high level today. So what I do have for you here, though, as you just saw pop up, is it is the sections within the Code of Federal Regulations, 45 CFR 75.302 and 303, where you can find this information. So tip number 4, make sure you understand the fiscal aspects of the NOFO, the Notice of Funding Opportunity. You heard Rhonda say it. She said, read it once, read it twice, put it down, pick it up, read it again. Well, I'm going to stress that same thing. This is important, and it's important to even focus on the fiscal aspects. So the fiscal aspects of the Notice of Funding Opportunity is the summary of funding, the budget, and those funding restrictions. That's really going to help you develop your budget and be successful by understanding what the funding can be used for. So while we're on the topic of budget, the 5th tip that we have for applicants with fiscal related information is to make sure that you understand the budget basics, how to create a federal grant budget. And so just knowing that we have standard form 424A for the budget, and there's the budget narrative piece, which is going to describe how you're actually utilizing the funding. And when you submit your application and when you submit your budget, you should make sure that everything within your budget is showing adherence to the program, those legislative mandates, the grant requirements, and any legislative requirements for the specific grant that you're applying for as well. And so within the budget, what I have for you here is just an example of what our current notice of award looks like, or an award once you are a successful candidate. And so this is the same way that your budget will be broken out in your application. So expect to break out costs such as personnel costs, making sure that they exceed the executive level salary cap, fringe benefits related to those personnel costs, any travel, and typically you'll have any driving travel, maybe any travel via use of aircraft, equipment, supplies, any contractual costs, indirect, and then other. And so this is important because we often get this question is, when submitting your budget, what do you put into the other category? And the answer is pretty simple. It's any costs that don't fit into another category. So keep this in mind as you're completing your budget when you submit your application. So one of the things I want to highlight here is indirect costs, because this is another area where we often get a lot of questions on. And so indirect costs are costs that are for common or joint objectives. So anything that cannot be readily identified to a specific grant, but are necessary for just normal day-to-day operations. So some of the examples are administrative costs, if you have rent, if you have information technology costs, maybe any janitorial or security costs. Those would all be things that we identify as indirect costs. And so when you're applying for a grant, you're going to either use a negotiated indirect cost rate if you have one, or if you don't have a negotiated indirect cost rate, you're allowed to use what we refer to as a de minimis 10% of modified total direct costs. And that can be used indefinitely, but what you need to keep in mind is that you have to have consistent treatment. So when you're applying for your award, unless there's a prohibition against how you can charge indirect costs, if you have multiple federal awards, you have to consistently use the same methodology for applying direct and indirect costs. So tip number 6, make sure that your organization has documented organization policies and procedures. And for the specific grant that you're applying for, you may need some additional grant policies and procedures, but just having those overall organization policies and procedures will be sufficient when you apply for your grant. And we do have examples on our HRSA Manager Grants webpage, which I'll talk about in just a few moments, that can give you an idea of the types of information that you need in your policies and procedures, and at a minimum, what needs to be included. So tip number 7, and I can't stress this enough, and as I mentioned at the beginning, you know, not everyone on this phone is fiscal staff. Maybe your fiscal representatives are not on the call today. But what's important is that when you apply for a grant, you should develop a plan within your organization to have open communication. So ensure all the staff that are responsible for the management of the grant, or that will be responsible for the management of the grant if you're a successful candidate, are aware of all the grant requirements, what the funds can be used for, how everyone will play a role in the management of the grants if you're successful. And doing this and having a plan ahead of time will help you be a successful recipient. And so we can't stress this enough. Okay, the next thing, tip number 8, is to understand the audit requirements. In the Code of Federal Regulations, subpart F, it identifies that if you expend greater than $750,000 in a single fiscal year, you're required to have a single audit conducted. And so this is something to keep in mind if you are applying for an award and if you already do have additional federal funds. So this $750,000 threshold is what will require a single audit. And the single audits do need to be conducted by independent accounting firms. And it is required that it's completed within 9 months after your fiscal year end. So keep that in mind if you plan to apply for substantial grants greater than $750,000. The next tip is more of just an understanding that HRSA has oversight. And so tip number 9 is to just understand that all of these requirements, HRSA has the right, if you're a grant recipient, to perform site visits. We have the capacity to access your books and records pertaining to the grants. We can initiate grant reviews. We can initiate any costs claimed under the grant, and really review your policies and procedures. And the reason why I bring this up, and the reason why it's important to consider when applying for your grant, is if you are a successful candidate, you would need to be prepared to show HRSA this information. And so all of these requirements that I just talked about, it's important to be able to document them. So when HRSA does perform their oversight, you can show that everything that you have in place at your organization is what you said you had in place when you submitted your application, and it shows your fiscal oversight and management of the grant. And the last thing I want to provide you with today is just to understand that at HRSA, we have a lot of resources that are available for you if you do successfully obtain an award. So we have fiscal technical assistance site visits we offer. We can do policy and procedure reviews to help you ensure that your policies and procedures are robust. We have this HRSA Manage Your Grants webpage, which has technical assistance calls on it. It has financial management tip sheets. It has the financial management requirements, which is that document that I identified before, covering these topics on the right and what needs to be included in your policies and procedures. And we're always happy to help and provide you with fiscal technical assistance. And so some of the areas that we can provide this fiscal technical assistance is on your reporting, record keeping aspects, how to update your financial management systems, how to have effective budget management, time and effort reporting, just to name a few. But overall, we can assist with the entire aspect of managing your grant from the fiscal perspective by providing you fiscal technical assistance to help you be successful in the management of your award. And so some of the resources I want to provide to you are just linked to the legislative mandates, the Uniform Administrative Requirements, 45 CFR Part 75 that I talked through, our HHS Grants Policy Statement, as well as our HRSA Manage Your Grant website. And that is all we have today. So I'm going to turn it back over to Cassidy.
Thank you so much, Stephanie. And thank you guys for hanging in there through some of our technical issues. Technology is not always our friend. So I apologize, Rhonda and Stephanie, but you guys did fabulous. We do have a couple of questions. So let me get to those. Our first question is, when submitting a grant, can you reopen your application to make revisions prior to the deadline?
And so I'll say this is the grant is submitted through the grants.gov works system. So they do have a workspace in the system. So I would have to say I'd have to do a little bit more digging when you say reopen, because I'm not sure if you mean if it's a resubmission, pulling it after you've already submitted, or if it's something that you want to continue working it on but you haven't submitted. So I'm going to defer and say that through the system in grants.gov, you can submit through that system, but I'd have to follow up a little bit more with you to see about the resubmitting. So I can't give you an exact answer on that yet. But I'm happy to follow up and then provide that back to you, Cassidy.
Okay, great. Thanks, Rhonda. And then our next question in the chat says, does the $750,000 limit apply for non-competitive grants? For example, emergency planning grants that don't require application. Also, I assume it does not include money like Medicare reimbursement.
It does not include Medicare reimbursement, but it does include all federal funds that are received, even if they're not received through a competitive process. There are specific awards that are exempt. So without knowing the specific awards that you receive or the specific pot of funding that you receive, I would not be able to speak to that particularly. But if you want to email me, I'm more than happy to provide you with additional clarification for that specific example. But it is federal funding received. And it's also if it's received as like as a pass-through or through a pass-through entity. So even if you're a subrecipient and someone else gets a federal award and then you get money from them, that still counts towards the $750,000. Hopefully that helps.
Great, thank you so much, Stephanie. And it looks like those are the only questions we have in the chat queue.
And Cassidy, I'm sorry. I do have one question from someone that came to me, so I will answer that. I think it may have only come to me, and it was with the subscription, would you be notified of upcoming grants being posted? And so I'll say once again, with grants.gov, you have the ability to manage your subscriptions. If you want to get information about new grants, if you want about forecasts, you would manage those subscriptions yourself in the grants.gov system, and how you want to receive them. The other question that was asked was discussing eligibility for for-profits. There are some grants that may be available for for-profits, and so what I would encourage is, as you're looking at the grants, you'll need to look at the eligibility section. That will specifically outline what types of entities are available to apply for those particular grant funds, whether it be nonprofit, for-profit, academic institution. It will very clearly outline the grants, the partners that are able to apply for those particular grants.